Hey guys, welcome back to my channel. In today's video, we will discuss about Exodontia. I will cover this chapter in 3 parts. Let's start. In today's video, we will discuss about the definition of Exodontia, indication, contraindication, and complication of Exodontia. Let's start with the definition of Exodontia. Exodontia is defined as the painless removal of whole tooth or tooth root with minimal trauma to investing tissues so that the wound heals uneventfully and no post-operative prosthetic problem is created. And this definition is given by Joffrey. Now, the next topic is indication of exodontia. Extraction of tooth is indicated when there is a severe dental caries and tooth extensively destroyed beyond the restoration. Next, in case of pulp pathology. Next, in case of the periodontal disease, when there is an advanced bone loss with hopeless prognosis. Next is periapical pathology. Next, root fracture, impacted teeth, supernumerary teeth that causes crowding, retained deciduous teeth that interferes with the eruption of the permanent teeth, malpose or malaligned teeth. Teeth in the line of fracture when they interfere with fracture healing or are themselves fractured. Orthodontic or prosthetic indications. Orthodontic purposes such as serial extraction, where we extract the tooth for creating space for alignment of the other teeth. Prosthetic reasons, teeth that would interfere with the proper denture construction are extracted. Teeth associated with cyst or tumor involved in the pathological lesion of the jaw. Now, there are some systemic or radiotherapy related indications. Prior to the radiation therapy, teeth in the field of radiation extracted to prevent the osteoradionecrosis. Teeth causing systemic disease. The focal infection theory says when the cardiac or the renal condition where oral foci must be eliminated. There are some economic and the social indication of extraction. The economic reasons, when the patient cannot afford the restorative treatment, in that case we extract the teeth. The tooth causing pain with no treatment possible. When there is no other treatment is possible and pain still occurring, then we go for extraction. There are some miscellaneous indication also, such as aesthetic reason. When there is a grossly malformed or disfigured tooth that affects the aesthetic of the patient, in that case we extract such teeth. In the hemisection tooth with non-restorable root, in that case we extract the tooth. Now the next topic is contraindication of exodontia. There are some local contraindication. There are some local contraindication and systemic contraindication. Systemic contraindication is further includes relative contraindication, physiological contraindication, and absolute contraindication. In relative contraindication, there are some cardiovascular condition, hematological condition, renal condition, endocrine condition, and immunocompromised condition when extraction is contraindicated. Let's see all these conditions one by one. Starting with the local contraindication. Local contraindications such as acute infection or acute pericoronitis. The extraction in acute phase may spread infection. Ideally, treat the infection first with antibiotics, then extract the teeth. Next, acute ulcerative gingivitis. The systemic involvement possible in case of the anug. So we treat that systemic involvement first, then go for extraction. Then pericoronitis, swelling and trismus make extraction difficult. So resolve the acute phase first. Vascular lesions such as hemangioma, there is a risk of uncontrolled hemorrhage in these conditions. Now, see the systemic contraindication. हमने पहले ही देखा है कि सिस्टमिक कॉन्ट्राइंडिकेशंस में रिलेटिव कॉन्ट्राइंडिकेशन है, फिजियोलॉजिकल है एंड एब्सोल्यूट कॉन्ट्राइंडिकेशन है. इन रिलेटिव कॉन्ट्राइंडिकेशन देयर आर some cardiovascular, hematological, renal, endocrine, and immunocompromised conditions in which extraction is contraindicated. Let's see all this condition one by one. Let's start with the cardiovascular condition. First is recent myocardial infarction within 6 months. There is a risk of reinfarction, so extraction is contraindicated. Next is uncontrolled hypertension. It will lead to the risk of hypertensive crisis and bleeding. Next is infective endocarditis. The antibiotic prophylaxis is mandatory before the extraction in this case. Next is angina pectoris. The stress can precipitate the attack. So in that case, we manage with the cardiologist. Next is the hematological condition in which extraction is contraindicated. First one is the bleeding disorder such as hemophilia A and B, von Willebrand disease and other. Next is the thrombocytopenia. In case of thrombocytopenia, there is a low platelet count that risks the uncontrolled bleeding. Next is the patient on anticoagulant therapy such as warfarin or heparin. Now, we will see the endocrine condition where the extraction is contraindicated, such as uncontrolled diabetes mellitus. In this case, there is a poor healing or risk of infection, so we avoid extraction. Next is adrenal insufficiency. If the patient is on steroid therapy, there is a risk of adrenal crisis and steroid supplementation is needed. So we avoid extraction. See the renal and hepatic condition in which the extraction is contraindicated. First one is the chronic renal failure. In this condition, there is a tendency of bleeding due to the uremic platelets dysfunction. And drug modification is also needed, so we avoid extraction. Next is the liver disease such as cirrhosis and hepatitis because reduced clotting factor and bleeding may occur. Next is the immunocompromised state when the extraction is contraindicated, such as HIV and AIDS patient. There is an increased infection risk, poor healing also, and patient on chemotherapy. Now we will see the physiological contraindications. Very young children, basically the mixed dentition age, because the premature extraction of the deciduous teeth can cause the loss of space and malocclusion. The space maintainer is preferred. Elderly patient with the systemic compromise, the physiological aging leads to reduced healing capacity. Therefore, we avoid extraction. Tooth with developing permanent successor. The extraction of the deciduous tooth too early may damage the underlying developing permanent tooth germ. Extraction during the menstruation period because high circulating estrogen level may cause excessive bleeding, stress, and sometimes mood swings is also associated in many women during the menstruation period. Therefore, we avoid extraction during menstruation. Now, absolute contraindication. That means extraction is absolutely contraindicated in these conditions, like heavily irradiated bone. There is a risk of osteoradionecrosis. Extraction in irradiated jaw can lead to non-healing and avascular necrosis. Malignant tumor or lesion. The extraction through a malignant lesion can spread tumor cells and cause the pathological fracture. Next is severely uncontrolled systemic disease, such as uncontrolled diabetes, uncontrolled hypertension, severe cardiac condition, where any surgical procedure is life-threatening. At last, but very important, during pregnancy. During pregnancy, in first and third trimester, extraction is contraindicated because during first trimester, organogenesis occur. So extraction may lead the risk of miscarriage. So we avoid extraction in first trimester. And in third trimester, there is a chances of supine hypotension, which may lead to the premature labor. So we avoid extraction in third trimester also. And if extraction is very important, then we prefer such process in second trimester. Now, we will discuss the complication of extraction. It is not necessarily that these complications will occur in all the cases, but sometimes they are seen. Start with the immediate complication of extraction. Immediate complication occur during the procedure, such as primary hemorrhage, nerve injury, root fracture, oroentral communication, tooth displacement, jaw fracture. Next, moving to the delayed complication of extraction. They are seen hours to days after the procedure, such as alveolar osteitis, secondary hemorrhage, acute infection, trismus, and swelling. Now, moving to the late complication of extraction, which is seen weeks to months after the extraction, such as osteomyelitis, paresthesia, oroentral fistula formation, fibrous healing, and resorption. Next is the systemic complication of extraction, in which the whole body is affected. They are syncope, anaphylaxis, aspiration of tooth, bacteremia, bisphosphonate related necrosis. In part 2, we will discuss about the instrument that is used in exodontia and mechanical work principle of elevator and forceps. So thanks for watching and stay tuned